KDHS 0809 revealed was that we had only 2.5% of the women taking the minimum required tablets of 90 for that particular, the last pregnancy that they were being interviewed on. And this clearly shows that IFA, or iron-folic acid supplementation, which is the public health intervention for control of anemia in pregnancy, is not performing well. We've had challenges with that intervention. One, there was a supply chain problem. There was a breakage in the supply chain. And two, we also had problems with the low compliance by the mothers themselves. Low utilization in terms of even when they are given, they are not able to take the required number of tablets. And thirdly, the health workers themselves also did not have enough information and therefore not well motivated to be able to dispense the ferrous sulfate and iron and folic acid supplementation that were being given at that time. So there were many issues around it. Many tablets also, there were also many tablets to take, because a mother would end up going with the 2 big packs of tablets home. And taking these things on a daily basis, and you are taking 3 times in a day, it's also not easy for the mothers. And because the type of system we had at that time in terms of delivery of the pharmaceuticals in the health system was the push model, a lot of these were going out routinely, but on the other side they were not being used as expected. So there was a huge pileup of the ferrous sulfate and folic acid tablets occurring in the health facilities. Because they were also not being utilized, many of them had to be destroyed because now they were expiring. So with that type of scenario, there was a need really to utilize what we had in the health facilities before we even procure more. But now we have been able to correct that. First of all, we did revise our guideline in terms of looking at the WHO recommendation. Now we have gone into the combined formulation of iron and folic acid. So the mothers will only take 1 tablet per day. And we have also gone out and coming up with a very good package in terms of giving information both to the health worker and to the mother. So we are now working on a lot of behavior change communication materials to further create awareness to the mothers and also to the health worker, so that we can see improvement in uptake of that. So we hope we can move from 2.5 to our target is by the end of this plan period to have reached about 80% coverage, so that we are at universal coverage of with iron folic acid supplementation. Yeah, because there were huge stocks and they were all expiring, there was a decision that was made. Let us stop procuring, but utilize the huge stocks that we have. But at the same time, we hadn't put in a mechanism of how we were going really to reinstate the supply chain once what was in the field was utilized. So for quite a period of years, there were no supplies. But finally, after negotiations and with very good support from our senior leadership from the ministry, we were able now to return it back to the essential drug list. And again, through a very good negotiations, we have been able now to be, the government has been able to be supported through the international donor agencies. In fact, UNICEF was able to procure some drugs to support some counties, but right now the ministry and the government has committed itself in taking credit from the World Bank, and they have now procured a iron folic acid supplementation, and it is going to be available in all parts of the country in all health facilities at no cost to the mothers. So the next major thing is to make sure that the mothers actually come early enough into the health facilities and they can now be able to access iron-folic acid supplementation.